Hello, and thank you for joining today's virtual education program with Cancer Support Community Los Angeles, or CSCLA for short. I'm Larissa Montalvo, and I welcome you to this week's webinar titled CSCLA Virtual Program Update, Offering Supportive Services Across a Diverse Digital Landscape. Today, we'll be joined by Cancer Support Community Los Angeles' very own Shannon La Cava for a review of the exciting impact of CSCLA's virtual programming and a discussion on our growing strategy to offer accessible, inclusive, and personalized virtual and in-person social and emotional services for individuals impacted by cancer. Before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing vital social and emotional support to families facing cancer, including patients, caregivers, and their loved ones, all at no cost. Our programs include support groups, healthy lifestyle classes, social activities, and educational programs such as this one. If you'd like to learn more about our services or watch past webinars, please visit our website at www.cancersupportla.org. Without further ado, I would like to welcome today's speaker. Dr. La Cava is a clinical psychologist specializing in psychosocial oncology, and more importantly, the Chief Clinical Officer and Director of Programs and Research here at CSCLA. She's an active member of the American Psychosocial Oncology Society. Dr. La Cava believes in a family systems approach to quality care. Her research interests are in multi-disciplinary engagement to support the psychosocial needs of pediatric, young adults, and adult patients and caregivers. Welcome, Dr. La Cava. We're so honored to be hosting you today.
Thank you, Larissa. And hello, everybody. I wish I could see your smiling faces. I'm able to take a peek at everyone's name as you're joining, and I miss you, and I am so appreciative of you joining the meeting today. So I want to put a big shout out to Larissa and Edlin, who is here virtually, but you can't see her yet. We might be able to draw her out later, but they've done so much to put this talk together. So thank you very much, Larissa.
Thank you. The floor is all yours.
Thank you. All right, so we'll get through the tech piece here, and my slides. And here we go. Okay, so hopefully everybody can see this okay. Okay, so we're going to talk about the virtual program, and if you are remaining kind of engaged with CSCLA, you will understand that everything that we do right now is virtual. We moved quickly last March, and we continue to offer our virtual programming. So I'm going to talk a little bit about that and the trajectory going forward. And we're kind of calling it across this diverse digital landscape. So there's lots for us to talk about. So first off, I have no financial disclosures to share with you outside of that I work with CSCLA. And then to give you just a little background of what we're going to talk about today, this is kind of like a little table of contents, but I want to introduce or reintroduce a little bit of CSCLA and what we look like, have a photo to share just in case it brings back fond memories. Then we're going to dive into the virtual program and kind of what's guiding our virtual program. And that includes assessment, collaboration, and innovation in different areas and details. We'll then look at the impact on our virtual program from each of those areas to ultimately talk about an evolution of care. So here it is. For those of you who have not ever had the opportunity to join us in person, this is what it looks like when you kind of walk in our doors. We have a very open, inviting space, and we are going to be ready to invite you all back when it is safe to do so, and we can actually see our smiling faces in person. And then as a review, CSCLA and all of our CSC affiliates, our whole network, we have about 5 core components of programming, and that includes our group support and counseling. So that's the emotional component, that social and emotional piece. We have educational workshops such as this, healthy lifestyle classes, many of you attend. We have Qigong and yoga and mindfulness, all different styles of classes with more and more growing each day. We have social activities and resources. And then we have a parallel to that for our child, teen, and family program. And I am excited to say that we have a brand new clinical and youth manager that is going to be running all of our child, teen, and family services. Her name is Sigal Khan. She's an LCSW, and I believe she's listening in today. So we'll do a big shout out, and I can't wait to introduce you all to Sigal. So our virtual program, and as I said, we had to move quickly. Our virtual doors open on Monday, March 16th. So if any of you, like I think I've committed everything that's happened that last week of work in-person services kind of to memory. So we were all here on Thursday the 12th, on Friday the 13th of all days. We had no programs and we said, okay, we're going to find a way to get this moved over into a virtual and online program. And we opened those doors that very first Monday to all of our support groups, and very, very happy to share that we had all of our facilitators able to transition into that realm. We did not really close any groups. And in fact, we very quickly started growing. So what that looked like was, okay, let's use our program evaluation to find out what we need. How do we want to grow? What is the feedback that we're getting from all of our participants and the individuals that use our services? We did needs assessments. And then as the year has progressed, there's been advances in technology. Not only our own learning curve, but the technology itself is kind of changing and adapting to the needs that we have. So one of those areas of assessment are the support care plans. So if any of you have joined in, actually since about, I think September of last year is when we really started implementing our support care plans and our screenings into the onboarding into our virtual program. This is an online tool, a survey that just kind of assesses the level of distress for somebody coming in for the first time to our services. So it is customizable, it's validated. We have this actually through our headquarters, so all of CSCs are able to utilize this tool. We also can utilize it in hospital partnerships, and it looks into those areas of emotional concern, symptom burden, body image, communications with your healthcare team, relationships, transportation, all these areas that can impact a person when there is a diagnosis for themselves or a family member. To give you an idea of what we're looking at with our support care plans, it's broken into these areas here in red. And I understand that you're all probably watching this on different size monitors and screens, and this might be very small. So I'll look a little close for you. So emotional well-being, we're going to look and see, are you feeling sad or depressed? Is there any worry for the future? We're going to look at symptom burden and impact. That looks like physical discomfort, feeling fatigued, maybe that chemo brain component. Our body image and healthy lifestyle area of the screener looks at exercising and being physically active, or if there's concern about how you look or feel, including eating and nutrition. Healthcare team communication is, are you able to make a treatment plan or treatment decision? Do you need help communicating with your doctor, or what that looks like now? There's relationships and intimacy questions, and that's about sexual function, fertility, intimacy issues, or just intimacy strengths. And then also just any problems that you might have with your relationships. And there's also a question about tobacco and substance use. To give you an idea of what that looks like for our members, this is data that's come from our headquarters. So this was published in 2020. So this was looking at about just over 2,000 different respondents. And you can see it's aggregated, so meaning it's de-identified. And this is just a glimpse of all of those that have reported their information or utilized this tool across our affiliates. At the end of 2020, or when this was published, again, from all the data from the inception, eating and nutrition was at that 62%. So 62% of respondents endorsed that eating and nutrition was an area of their distress, or at least a concern that they wanted to have more information on. That was followed by exercising and physical activity, worrying about the future, and feeling too tired to do the things that they need to do. So looking a little bit more closely at the information that we've gleaned just from Los Angeles. So this is from those that have utilized the support care plan in LA. And this was, again, the last 9 months. We started capturing this for the virtual programs in September of last year. And this data is till about a week ago when I put this deck together. So we got about 9 months. And the number one for people living with cancer was worrying about the future. So about 66 people endorsed moderate to very serious concerns about the future. That was followed up by disruptions in school, work, and home life, as well as feeling fatigued. And then I would like to say that we also have a caregiver survey. They have a few more questions to answer on their distress screener, but in those last 9 months, the caregivers top endorsement was also worry about the future. And you can see it was even higher than those that endorsed that from the people living with cancer side. So another area of assessment is program evaluation. And if you were utilizing our services last September, you would have received an email. We did about a 2-week time frame where we were asking people to give feedback for our programs. And this is the data that we gleaned from that survey. So at that time in September, we had about 179 people respond to the survey, and we found out that the majority of the participants were patients or caregivers, with a resounding amount of 81% patients and 17% caregivers. But we also have those that were using our services for bereavement as well as healthcare providers. The numbers, I think, have shifted a little bit more. We are having some more utilize our services for bereavement, both our bereavement grief support group, as well as for individual counseling. And that's for individuals of all ages, including children or teenagers that may have a family member who has died, as well as there's the CTF program for individual counseling for kiddos that may just be either experience a cancer diagnosis themselves, or they have a sibling or a loved one with cancer. So what are people attending? So this was, I think, kind of exciting for me to see. But again, out of those 179, over 50% were using online groups in some fashion. So 40% almost online groups only, but then looking at individuals that used our group support plus one other program, we got up to we got to 55. So we have a larger amount of people using both the group and something else. Healthy lifestyle program, you can see there, 28% using healthy lifestyle, and then healthy lifestyle plus an additional program was another 11%. So basically 27% of the participants in combination of programs there. And that's looking at online groups plus the healthy lifestyle groups plus. What devices are being used? So 56% people are using desktops or laptop computers, and then tablets was about 9%, and 30% of people are using an option of either. They might use multiple devices, so it's depending on what they're accessing. So I thought this was useful information to see. And then we had a question about the ease of online access and use. This was also very good news for us, that 82% said that this was easy, 7% said that it was difficult, and 11% neutral. I do want to say, though, that I understand that this survey was also electronic. It came in an email. It came to individuals that had attended our programs that were in person, as well as all the way into our virtual program. But I want to say that this was a voluntary survey, and I'm sure that we are probably missing some that had a difficult experience, and they may not have continued on to our virtual programming. So what we're doing with this data is understanding that we can make it easy, but we might have some work to do, and we want to do as much as we can to get everybody connected during this time. Sense of connection and support. So this is individuals that are saying that they used our virtual services, and 83% agreed that they did feel a strong sense of connection and support. And in terms of future engagement, so this was from last September again, about 80% chose a hybrid programming. And when we talked about hybrid, it was the offer of attending a virtual support group, and when safe to do so, attending an in-person support group. So there was a nice stretch there that were interested in both programming. And then about 10% online only, as well as about 9% wanted to just come back into the in-person services. So we'll utilize this information as we go forward in how we design our programs, and definitely in a hybrid way, because we want to get back in person, but we also understand that there's a lot that we've gained while we've offered this in a virtual space, and I'll have more to show you about that. Okay. So what we also got from our program evaluations was some actual qualitative data, meaning we were able to ask people their experience and get an understanding of that individual's utilization of our programs and how they wanted to share their feedback. So understanding that there was a pandemic and that was the catalyst for us all going virtual and going online, there was still some wonderful data here that I think is going to be so useful in how we see our programs going forward. Looking through these, some saying that the stay-at-home order and the social restrictions, they haven't been easy because they live alone. So this was a way to connect. Others saying that it's harder to attend in person because of disease progression. Some say that it's also transportation. We might be farther away from our physical locations. And so this gave them an opportunity to attend where they hadn't before. Other areas in terms of just those restrictions causing anxiety, but the classes can reduce stress and improve mobility and just give some alleviation to that distress. So you can go ahead and read through these, but basically it's just that we got a lot of positive feedback. And again, there are some that it was difficult, and we understand that, and we'd like to see what we can do to make things easier. But I think this is something that warrants an absolute continuation of our virtual programs to make sure that everybody has access to care going forward. So keep an eye out. We are building our next program evaluation, so that will be coming soon. And you can see how we utilize that data, not only to inform our programs and to get a good sense of what's working, what's not working, and kind of course correct as we go just programmatically, but we can use this information in grants and as we apply for funding. Excuse me, I think I have a motorcycle going by. But we're able to use this for so many reasons. And it's a wonderful way also to share this with our providers so they can see that the level of care that individuals are able to receive, even though they can't come into our in-person doors. So one more part of an assessment is our stakeholder committees. So this is actually information that we're getting from those that are pretty much champions of our community. So we started the Cancer Equity and Diversity Committee. And this was a committee of basically champions within the healthcare system, as well as other like-minded, like-missioned organizations around Los Angeles. And we really wanted to get together to see, like, what are we doing right? Where do we need to make corrections? How do we make sure that we have services that really do promote access and inclusivity to all in our territory here of Los Angeles? And the Cancer and Equity Diversity Committee, the name said, came actually from our very initial meeting about a year ago. And it was about the idea of thirst. So sed in Spanish means thirst in English. And it wasn't to look at this group as less than or where there might be gaps, but also to see that we want to have the voices of this greater LA community and utilize that resilience that already exists in the greater community to strengthen our programs and to really adapt our programs to what the needs are. So it's really like having everybody come together, like everybody gets not just a seat at the table, but a voice in the conversation. So we've utilized that, and I'll show you a little bit more of how we are using our Cancer Equity and Diversity Committee. Another area is our Professional Advisory Board. So although they are still called dinners, they're virtual, and I think it's kind of a bring your own dinner. But in the past, we would meet 4 times a year with our Professional Advisory Board. And these are professionals in the LA area or even a little beyond that help and talk with us about what we're doing right, what can we do to improve, how we can connect better with the hospitals. And they, again, are also champions within these organizations and hospitals that help kind of give us feedback and help steer us in the right direction when making decisions in terms of our programs, as well as all kind of organizational decisions. And we moved it online. We call them our dinners, but we still continue to meet. We didn't even have a hiccup, really. And we have some really great attendance virtually, which is, I think, a good thing. And we're learning what's working and what's not working in these other organizations so that we can hear, when they have advancements in technologies, how can we meet that? How can we meet them where they're at and get them information like digital flyers or social media in ways that we can connect in potential like novel methods that we didn't use while we were in person. Collaborations. So again, coming out of the Cancer Equity and Diversity Committee, as well as just our existing organizational partnerships, we can co-brand, we can join together, we can meet each other online, because I think it's very important to note that this was a shared experience that we were all having. So we were all, forced to kind of shelter at home and go virtual and not have that connection. So what does it mean for our organization and what does it mean for our neighboring organization? Kind of the same thing. So how can we connect and build together? So we've had some amazing organizational relationships as well as just personal relationships with nonprofits in the area as well as hospitals. So we're doing a lot of teamwork, and out of that came our HEART program. So this was a very active and long-term goal starting in our strategic plan about 3 years ago to start creating more and more programming that would be able to branch away from just our main location and into the larger LA territory that we serve. And that came through with collaborations with the Angeles Plaza Senior Activity Center. They are located in downtown LA. The Village Health Foundation, where we've had a group for about 2 years, and that's in the Arlington Heights area. We're working with the Pediatric Brain Tumor Foundation to secure a grant so we can do some shared programming. And then we had the existing Spanish-speaking groups that we had at Adventist Health White Memorial. So really, the HEART program, standing for Healing Equitably Through Action, Resilience, and Teamwork, it's let's get together, let's work together, and let's really support this greater and more diverse Los Angeles landscape. So we're excited that that's growing. Some of this was in person and moved online. Some of it's brand new now because we're all kind of looking for new content and how can we work together. So at Angeles Plaza, we are starting a Korean speaking support group for patients and caregivers. And we are really excited to even see what's next with other organizational relationships. And then presentations. So much like this, we're able to kind of offer this in different areas. So we had an event in December where we were able to bring speakers from around LA and from those hospitals that we talked about and those champions that are in the community. We've also had the opportunity to join in other discussions and dialogues by attending the SoCal Women's Conference. Myself and Yvonne Monteverde, who is our Spanish-speaking facilitator and outreach coordinator, we were both able to present it at a Southern California conference on what we've learned and how we've grown as an organization. We've attended hospital team meetings. Larissa, who you met at the beginning of this, she's also gone into some of the hospital team meetings to introduce our services and really have a warmer way of I guess, introducing newly diagnosed patients or individuals that are just looking for care to our services, so it feels a lot more comfortable. Co-branded workshops. So again, what was once called the Lunch and Learns, if you recall, that we do online like this. We've done this with other organizations like the American Institute for Cancer Research. They had a phenomenal nutrition talk, which was so well attended. And it's really about, okay, let's work together. We both have strong brands, we both have strong audiences, and we have a real thirst for that information. So I think collaboration has been just a way to go. And again, this will continue. And it was one of our favorite things kind of coming into even our in-person care. So also what we have gained from our Cancer Equity and Diversity Committee is how we look at our programs, and not just those 5 core components that I showed you at the beginning, but how do those core components of our work fit into the diverse Los Angeles landscape. So we've kind of parsed it out. Let's look at children's and teens, the LGBTQ plus community, the Black community, the Latinx community. Where do we have gaps? How can we improve? Let's listen to the community. Our needs assessment are within the community. We'll find presenters, we'll find speakers, and we'll find facilitators that are from those populations and communities to really extend what we know and what we've done for almost 40 years now, but into a very comfortable and inviting and trusting relationship with those communities. So we gain and shift our services to what those needs are. So it's been a lot of learning for us and a lot of engagement, and it's been wonderful. So with that, you can see that we're adding groups, we are adding programs. Even some of our healthy lifestyle classes have changed to really be able to support all communities. We have, I think I'm jumping ahead, but I'm excited because we're about to have a mindfulness program in Spanish. So there's a lot of growth. Okay, innovation. Now we're at the innovative part. So some of these things we had some handle on, right? But we didn't have to utilize this when we were in person. So the doors opened on March 16th virtually. What did it mean? So some of the areas that we've adopted for the program delivery include Facebook Live. As I was just waiting for Larissa to invite me into this talk, she posted everything that we're doing on Facebook Live. We have a video library. We're saving these talks. We're putting them on our website, and people are coming in and viewing them later because there is a lot more flexibility. You can look, if you can't attend in person, you can watch it on video. You can share it. Some of the other platforms, and I'm sure you've all heard Zoom, right? This is how we're really delivering most of our programs, our healthy lifestyle, our groups, it's all on Zoom. DocuSign, that is a way that we are now getting signatures. Once upon a time, you'd come into the community, you'd fill out a paperwork, right? So now we're able to send it digitally. And that was, a process as well. When we very first came online, it was like, okay, how do I send this to somebody? Let me send you a PDF or a document. Do you have to print it and sign it? How do you send it back? Let's mail this to you. So these iterations have made life easier, and we will continue to utilize these services because I think it really is helping make an easy transition into the program as well as an introduction for somebody who's brand new. So procedures have changed as well. So there's the establishment of our new onboarding, and it's kind of the new welcome packet, right? So we have e-blasts instead of calendars being shared. We have social media. We have orientation meetings that are online. So instead of coming into our community and sitting in a support group, you're able to have somewhat of a similar experience. There's a slide deck. We have two amazing group leaders for our orientations, Michal Bick and Andy, and they are just wonderful at inviting new members in. And they make it as comfortable as I think it was when we were in person. It's just a little different. And then our welcome packets, we'll send out etiquette and expectations. What does it mean to join a group online? What should I do? So we can give you some tips, and we've also made modifications to that as we've learned from our participants what's working and what's not working. So lots of change. So if you have attended our virtual orientation meeting, you might see a slide like this, and I can do a quick intro here. So you saw Larissa. Kelly Hagan is our administrative assistant, and so she does a lot of work with our info line as well as Edlin. And Edlin, I'm hoping to introduce you to at the end of this talk, but Edlin's our new virtual program associate. And then Andy Moore and Michal Bick, those are the leaders of our orientation meetings. So while we can't be there in person, and while we're sometimes on the phone or there's a lot of emails, we do want you to know who we are. So we're trying to make it as easy as possible to have a face to an info account or have a face to those engagements that you have via email. So feedback is welcome here as well. My Lifeline is another area of digital technology that has been utilized before going into this virtual space, but now it's especially, I think, useful. So my Lifeline is actually it's much like Caring Bridge. It is an online program. It has been acquired by CSC, so we're very excited that this is shared across all of our network. And it is a way to sign up and kind of almost start your very own little social network. Unlike Facebook or Instagram, you decide who's in there. Only the people that you choose or connect directly into my Lifeline can see anything that you post. But it'll help. So if you want to send an update or an email, you can do it once and it can go out to all of your friends and family. There's a calendar. If you have an upcoming medical appointment that you need someone to drive you there. If you're looking for dinner one night, maybe you've had treatment and you're looking for some support, you put it in this calendar and people can sign up. There's also a lot of information sharing there. It's high in terms of its privacy settings are there. And you have a lot of autonomy in how you kind of design your own My Lifeline site. But if you have not done so, I encourage you to check it out. It's cscla.mylifeline.org. And it is a great way to just, improve those connections and get more of bring your social circle in, I would say. I talked about social media, so here we are. If you haven't done so, I encourage you to join our social media platforms. So we're on Twitter and Facebook, Instagram, and LinkedIn. And on each, our handle is @CancerSupportLA. So you can join, and we have amazing posts. This is where you'll see a lot. Another shout out to Kelly. She kind of creates all of our posts, but we're able to share what you see on our e-blast and what you might see on what we've had in our calendars previously. But beyond that, we've had contests. We had a pumpkin carving and pumpkin decorating contest for prizes. We have a young adult game night coming up, so we're really pushing that on our social media. Comedy Tonight, I hope you've had the opportunity to attend. Those are just really fun ways to engage and connect with CSE, and you can learn about them and so much more on our social media platforms. One other area that I do want to share that I think is really kind of exciting, and we didn't have the opportunity to do that as much in person, is share some of the news or some of the clinical trials or some of the information that's coming out from the local hospitals. So we are able to pass that along as well on our social media, as well as invitations to other nonprofits in the area that offer supportive services. So it's just kind of keeping connected. So what does that mean, right? So what did we talk about? We talked about assessment, we talked about collaboration, innovation. So what does that mean? So if we take all that and we utilize that to inform some change, obviously we had quick change on March 16th going from in-person to virtual, but as we continue to grow, what does that mean? So here we go. We're looking at the virtual delivery that we've seen, and this is all of our evidence-based supportive care services. So we did a comparison of just CSCLA, our attendance from 2019 to 2020. So this is just quarter 4. So looking at the last quarter of 2020 in comparison to the same time frame in 2019. We saw an increase of 11% in our healthy lifestyle attendance, and our support group attendance increased by 30%, which is pretty phenomenal, I think. In terms of our support group program offerings, it increased by 10%. So what that means is that we added some program and we still saw this many more people visit, not necessarily individuals, but how many visits they made. And then our individual counseling increased by 21%. So I thought this was really, really telling of what the needs were currently during this pandemic. There's a lot of additional isolation, knowing with what we do that isolation is one of the biggest areas of distress with a cancer diagnosis. So it's compounded. So we were able to see that people were getting connected. There was a decrease in our social activities. I think there might have been some Zoom fatigue, right? We all experienced that. There's also a decrease in our child, teen, and family program. And a lot of that was especially kind of coming into this as, in the early parts of 2020 and the early parts of our virtual care. Kiddos might have to go to school virtually. There was a lot of hiccups there. And as well, there is a little bit harder sometimes to make sure that we can ensure confidentiality or attention or even desire to go into individual support group or counseling via Zoom. But again, we are very excited because now we can actually offer that in a group instead of just individual, and we can do this in an age-appropriate way. And we have Sigal here to help us. So program impact, even a little more recent, this is looking at January through March of 2021. And this is, again, a wonderful graphic that we first shared on our social media. And in that time frame, we had 20 educational talks. We had 150 healthy lifestyle classes, 163 individual counseling sessions. And that's huge. You can look through the other data. I'll share, we've added groups. We have a colorectal support group. This is coming from those distress screeners, that's the care plan that I was talking about. And just the information that we glean when somebody fills out their very first annual visitor form. What kind of diagnoses are we seeing? Typically, I think breast cancer diagnosis and prostate cancer diagnosis are kind of at the top. But third down, we had colorectal diagnosis, and we did not have a group for that. So let's start one. So we really use the data that we are gaining to inform the work that we do. So that's starting up now. We have a few people that are ready to join. If there's anybody out there with colorectal cancer or has somebody with that diagnosis in their family, send them our way, and we're going to get that group off the ground. Again, our Korean speaking group that I talked about, we have a new Spanish speaking networking group, which is more for patients and caregivers in treatment, post-treatment, just a space to get together and connect. Coming soon is that mindfulness class in Spanish. We also have a kickboxing class in Spanish. And I'm thrilled to say that very soon we're going to have a young adult caregiver group, and that will be in English. And that is one of the groups that we've been receiving through feedback, a lot of interest, so we're able to make it happen. And then here's some additional comparison. This is from 2020 to 2021 in the quarter 1 as well. And overall, we had an increase in attendance across all of our programs by just under 50%. Let me say that again. We had a 50% increase in attendance across all of our programs. What that includes is those 5 pillars like I talked about. And then in looking at individual therapy, It's looking at individuals, adults, children, couples therapy, family therapy, open to option sessions, research sessions. So all of that's included, but we've saw an amazing increase. And again, about 30% increase in the actual programs offered. Okay, so here we go. What does some of this mean? So we're still looking at the delivery, right? So we have, I think, increased collaboration led to increased attendance, right? We had more targeted programming, more specialized programming, and more targeted relationships that we could work with one another, like our AICR talk. We had greater reach through co-branding. We've even connected with our Southern California affiliates, and this is a first for us. We have affiliates in Westlake Village. They service the Valley, Ventura, and Santa Barbara. We have a Pasadena location and a Redondo Beach location. And we're considering ourselves as CSC SoCal because we are now virtual. So what does that mean? We've done some talks together so we can have one amazing presenter and share that presentation across all of our affiliates. And we're continuing to think that way in a collaborative sense. Another thing is that we kind of need to think outside of the box. I told you about that decrease in our child, teen, and family programs. So we started making videos, some wonderful videos that were a little bit educational, very supportive, things that a child could do with their family. We had mindfulness jars and worry boxes and some really great videos, and they still are on our website. So you can find them there in our child, teen, family portion of our video library. Okay. So clinical services. And I will tell you that I did not long ago a presentation much like this for a lot of providers, those that provide psychosocial oncology care. And I looked at this slide, but more from the sense of how we support our clinicians. And I think it really is appropriate all the way through the reach to those that are using our services for their own emotional and social support. And I think if you look at those photos, I've been there. I'm sure, you know, even kind of coming on to a talk like this, like, is my technology going to work? Oh my goodness. So instead of throwing our computers out the window, sometimes we pull our hair out a little bit and we have to like pick ourselves up by our bootstraps and get going. But I want to just say that it's normal. We feel that way. And I've expressed that to our staff, and I know our staff is expressing that to our members. So it's really about promoting that acceptance in this space that we're at right now, that it can be hard. Encourage flexibility, we welcome vulnerability, and we model resilience. And I think this is how we are all able to do this together. Another area of impact is increased local and national connection and communication. So I talked a little bit about how we can do shared events and shared presentations, but we can share what we've learned. I've talked with other organizations. What's working for you? How did you do this? Let me share what I've learned. We shared a lot from CSCLA with our national community, our national affiliate network, in what was working for us, because we were one of the first to get our entire program up online in that digital space. We really wanted to pass that along with others. So we have a community hub through our headquarters where it's kind of a wonderful library of everything that individuals are utilizing in each of their affiliates so we can learn from one another. For me specifically, I get together with program directors, other program directors, so we can hear what's working and share. And to the point of that previous slide, what's hard? Sometimes we need to talk about that too. We communicate more with external agencies, and we've had opportunities to speak and to engage with others. So bringing this all together, we are looking at utilizing all of that feedback through assessment and through communications and through technology and innovation, and bringing that into what we have as our virtual program now, and continuing to course correct, because the virtual program of tomorrow might look different than it does right now. And it's all through that information and using the evidence of the services that we provide and the feedback from our members. But I will say that is exactly how we're going to be able to get back into the community. So utilizing assessment, collaboration, and innovation in how we establish in person, what does that look like? What does the transition from virtual programming into in-person look like? We're going to utilize feedback. We're going to utilize our professional advisory board. We're going to utilize information from the CDC. And it's that same idea and just a different model. How do we get back together? And I will tell you, as I see all your names popping up here, I wish I could see your faces. And one day I hope that we can do that very soon. So I believe that is my last slide. So I will stop sharing. But as Larissa said, this is my email. You are all welcome to reach out at any time. And I want to welcome you to our virtual community if you have not already. And for those of you, it's good to see you here. So I will stop right there and invite Larissa back.
Hello, thank you. That was so wonderful. It's so nice to kind of hear an overview of all of our programming this past year, even though we live it, but it's nice to see from the outside what it looks like. So if anyone has any questions, please feel free to enter them in the Q&A feature, and I will be reading them to Dr. La Cava. I'm also typing her email into the chat room if you want to copy and paste it.
And I did see someone say Lifeline is excellent. So wonderful to get feedback. It is a wonderful way for people to connect. And if you haven't done so already, that's the CSCLA.mylifeline.org. It is a great tool, and I welcome you all to try it out.
No questions yet. We'll give it a little bit of time here.
It is fun. It's like I get to cheat a little because I can see who's on the call. So I just want to do little shout outs to so many of you that I have met when we were in person. And so thank you for sticking through all of this, the ups and downs, the trials and challenges of virtual programming, but you're still here and I miss you. And I think you're so connected. I, at this point too, want to say thank you to Larissa and the whole program team, because I think they are the face of our virtual community and they are the support that each of you are able to tap into. So shout out to them, but just so good to see all your names, and also from other organizations that we work with, and just that same idea of collaboration. I'm seeing it here and I'm grateful to you all.
We are grateful for you and all the work that you've done in getting us on board. I mean, we were online within just a couple days of going virtual. We were up and going, and a lot of that is thanks to your resilience. So thank you. We had someone say that they've had some technical difficulties with Lifeline. You are always welcome to reach out to us, and we are happy to be of any assistance that we can to help out with any technical difficulties. We are not tech support, but we know our programming pretty well. And we're always happy to help. So feel free to reach out to us if you want some support. We also have another member who is saying not a question, but that the support groups have saved and changed her life. Thank you so much. That's wonderful feedback to hear.
Yes, thank you. And again, that was some of the data that we got from our evaluation. Was, I think, almost surprising for some when they got connected for the first time, especially if anybody had done an in-person program and then went to virtual. There was some intrepidation, some fear of like, oh, it's going to be different. I'm not there. But even from feedback that I've had with the clinical team in terms of what that process was like of transitioning, they felt this fond sense of connection that they weren't expecting. So it's so wonderful to hear that, and I appreciate you sharing that.
We have another member saying, Hugh saying, sorry for the pandemic, but thank you for going virtual. Him and his wife could never have participated otherwise. Another member saying, great program. This is great to hear. Julia Forth, our CEO, saying, thank you for the work you do. I've heard great things about this organization.
Thank you, Julia. Shout out to Julia. She does a coffee talk once a month. You should all attend. And I want to thank you, Hugh. It's very meaningful to hear feedback like that, sometimes with or without the pandemic, there's some that weren't going to be able to connect, and you could virtually where you didn't have the opportunity before. So thank you, Hugh.
We have another comment and our first question. Mimi would like to say she just wants to say that the yoga, breathing classes, etc., are so helpful for the body and mind support, and it's made a huge difference in her life. She says thank you. We are happy that you enjoy those programs, Mimi.
Yes, Thank you,
And
Mimi.
we have another question that says, will the program teachers have the opportunity to keep their classes on Zoom if that works better for them?
So wonderful, wonderful question. And like I mentioned a little bit of how much we're going to utilize to inform what the road back looks like. Part of it will be comfort level of our members, of our staff. And again, we really want to see what's working and what's not working, and where the programs will land. We want to be able to have a robust virtual and in-person like whole menu of programs. So yes, if there is interest to not really go back to the community, I think we can make that a virtual program, because like you said, people can connect that didn't have opportunity to connect before. So I'm not sure what each class will look like and where each class will land, and maybe we can get additional classes so we have almost a parallel or mirror of our virtual and in-person programming, especially with our healthy lifestyle. So more to come there. But yes, our hope is that everybody feels comfortable and safe.
Well said. We have a member asking if there is a West San Fernando Valley location.
Oh, yes. So our Westlake Village is the Valley, Ventura, and Santa Barbara is the service territory of our Westlake Village affiliate. So it is up like kind of in Ventura County, closer to Thousand Oaks area. But it is open like we are. It's virtual, but they are. But good question. Thank you for reaching out, Mona. Well, that might be it. I'll just kind of gab for a second and give people a second if you want to, but just again to extend my gratitude to Larissa, because I think she's held this program together so much virtually. And if we can, I don't know if she's still there. Is Edlin around? Maybe we can do a quick intro and shout out to Edlin if she's there. Oh.
Hi, I'm here.
Hello. Edlin, so we're so grateful. Edlin, you started March?
Yeah.
Gone quickly.
Mm-hmm.
So Edlin, if any of you do reach out and are looking for help, you will be getting emails from Edlin as well as Larissa. So Edlin is our new virtual program associate, and she's doing a lot of work also in the Spanish services that we do, and she's bilingual, and I think she is a great help, great addition, and just really hats off to both of you.
Thank you. Yeah, I'm just so happy to be part of such a great organization and such a great team. So I'm just so excited to see where our virtual platform goes from here.
Thank you. Thank you for allowing me to put you on a hot seat. I didn't tell you ahead of time that I was going to do that. This was all coming. It's rolling out live.
We have one more question that she heard that the Westlake affiliate is closed. They are not closed. Their programming has changed in moving virtual, so I'm not sure that they have their full programming that they had when they were in person. But you are still welcome to reach out to them as well. They are there.
And remaining on Zoom, we will be here. I've often said that, you heard me say we have 5 core components. I think our virtual program is now our 6th core component. It is vital to what we do. When individuals are able to come back safely, the choice to come back and resume in person is there. But there has been just such an amazing outreach in being able to connect with those that weren't able to attend when we were in person. There is no way that we can end this. So I'm very excited that I think out of all of this, I think it was a kind of a devastating year, but to see that there is some opportunity and that we can grow from that, I think we're welcoming that.
Well said. She said, thank you. Glad to hear. All right. That looks like that's all the questions that we have. Thank you so much again. Oh, it looks like we have a member raising their hand. I'm not sure if that's intentional, but Kathy, I can allow you to talk if you'd like to say something really quick. Go ahead.
Oh, I didn't know I did that. I just wanted to say the program was great today. The teachers you have are so wonderful. And I don't know that I could have gotten through either your in-house that helped me through my cancer, and then the isolation in quarantine during COVID. I think you saved my sanity because it gave schedules to my day and community. We saw people's faces, we heard, we talked. The teachers were all wonderful. So thank you.
Thank you, Kathy. Thank you. And it's wonderful feedback, and I really appreciate it. And happy to hear that we were able to provide that support, and that we had a team that was able to provide that to you.
Thank you, Kathy. Sorry for putting you on the spot, but those were very kind words, even on the spot. So thank you for that. All right. We have one more member with their hand up. Lisa, I don't know if this is intentional, but we'll give you one last try. This is the last question we'll take for today.
Hello?
Hello.
I just wanted to, if you could quickly put up the email addresses again. It went up so quick, and especially @something. I'm a new member. I haven't called anyone yet, so I just need the emails.
Yeah. Let me find that. Let me see my tech capabilities going backwards, but I think I can get that for you. There you go. Is that what you were looking for?
Yes, thank you.
You're welcome. Yeah, and then you can see our whole team. So too bad
Wonderful.
we don't have photos of all of you attending, but soon we'll get to see you.
And thank you, Lisa. We are welcome to the community, where we look forward to welcoming you. All right. That is all the time that we have for today. Thank you again, Dr. La Cava, for joining us. It has been such a pleasure to hear all about our programming.
Well, thank you for the invitation, Larissa. And thank you all for attending and taking your time out of a beautiful Friday to be online with us today. So I really appreciate it. And I can't wait to see you all.
And just a reminder that this talk is being recorded and will be up on our website video library within the next month. You can also watch it again at any time on Facebook Live, and follow us on Facebook while you're there. Thank you so much, and we'll see you next week.
Thank you.